Okay, so this is Israel, take one. So before entering the room, I washed my hands and I came into the room. Hi, my name is Israel. I'm going to be your nurse today. Is it okay if I can take a look at your wristband?
Yes.
Okay, can you confirm your first and last name and date of birth for me?
Okay.
Okay, so the reason that I'm here is I need to perform a full physical exam on you. It's going to take roughly 15 minutes. Is that okay?
Yes.
Yeah, okay, wonderful. So we're going to get started. Do you know who you are?
Yes. Tanda Lamini.
Do you know how you got here?
Yes, I came here by driving myself.
Okay, do you know why you're here?
Yeah, I have a headache.
Do you know what day it is?
12, 13, 25.
Okay, so the patient is alert and orient times 4. And next, we're going to begin by assessing. So, general appearance is like unlabored, no adventitious breathing, and patient is looks comfortable. So, I'm going to begin by assessing your gross vision. Do you mind covering one eye for me? How many fingers am I holding?
4.
4. Can you cover the other hand for me? How many fingers am I holding?
0.
0. Okay, wonderful. So, gross vision is equal bilaterally. Next, I'm going to check your pupil reactivity, okay? I'm going to go ahead and use this pen.
Okay.
I'm going to start by flashing it on one end and then on another.
Okay.
So, okay. Wonderful. Can you go ahead and look at me and then look at the pen? Okay. And then now, can you follow the pen? Okay. Wonderful. So, pupil diameter changed from 5 to 3 upon measurement. Pupils are equal, round, reactive to light, and accommodating. Next, I'm going to check your extraocular muscles.
Yes.
And I'm going to go ahead and use the 6 cardinal points of vision.
Okay.
So if you can just follow my pen.
Okay.
5, 6, okay. So cranial nerves 2, 3, and 4 and 6 are equal and reactive to the vision test. Next, I'm going to go ahead and check for your strength, your cranial nerve 7. Do you mind going ahead and smiling for me? Yeah? Do you mind puffing out your cheeks? Okay. I'm going to go ahead and press your my finger against your tongue. Resist it. Okay. Can you raise your eyebrows and now relax them? Okay. So cranial nerve 7 is intact. Next, I'm going to go ahead and check your for your jugular vein and carotid artery. You mind leaning back a little bit? Okay. So now I'm going to go ahead and, for the purposes of the video, we're going to say that this is 30 degrees. Do you mind turning your head over to the right? And this is going to be my makeshift lamp to check for her jugular vein. So no jugular vein distension to note. And do you mind if I can palpate your carotid arteries? Yeah, okay. I'm going to go ahead and palpate. So carotid arteries are +2 bilaterally. And sorry to say, I was checking it on this side, on her right side, for her jugular vein distension. Okay, no jugular vein distension to know. Okay, wonderful. Now, do you mind coming over? I'm going to check your upper extremity strength. Okay?
Yes.
I'm going to go ahead and have her squeeze my hands. Okay? Push. Okay? Now I'm going to push and you resist. Okay?
Yes.
So patient shows +5 strength in both upper extremities bilaterally. Now, do you mind if I can have you stand up? Okay? Now I'm going to check the anterior to posterior and transverse ratio. So this is the anterior to posterior. Now go ahead and face the wall. I'm going to check, this is the transverse ratio, and the ratio is roughly 1 to 2, indicating within normal limits, no barrel chest signs. And next, do you mind going ahead and taking a seat? Okay. Now I'm going to begin by auscultating the posterior portion of your thoracic cavity. I'm going to use my my diaphragm to auscultate. And I'm gonna indicate 5 points of auscultation in the posterior side, or anterior side. I apologize. Breathe in, breathe out, 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 breathe in, breathe out. Is it okay if I raise your breast?
Yes.
Yeah. Okay. Breathe in, breathe out, breathe in, breathe out. Breathe in, breathe out, breathe in, breathe out. Okay. Next, anterior portion of her body was clear to auscultation on all both sides. No rails, wheezes, or crackles to note. Now, if I can have you orient your body and face the wall a little more. I'm gonna assess her posterior side. So I'm gonna cover 7 points of auscultation. Breathe in, breathe out, 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 and breathe in, breathe out. Okay? Posterior portion of the patient's thoracic cavity was clear to auscultations. No adventitious sounds heard, and no rails, wheezes, or crackles heard. So next, I'm going to go ahead and begin assessing her heart sounds. Do you mind orienting your body towards me? Wonderful. So I'm going to begin by listening to the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. Okay. Starting with the diaphragm portion of the stethoscope, of the chest plate, I'm going to listen to her, to the right sternal border, second intercostal space, her aortic valve. Next, the left sternal border, second intercostal space, pulmonic. Left sternal border, third intercostal space, Erb's point. Left sternal border, fourth intercostal space, the tricuspid valve. And then the left midclavicular line, fifth intercostal space, the mitral valve. Okay, so S1 and S2 sounds were noted. No murmurs, rubs, or gallops heard. Next, I'm going to go ahead and switch over to the bell portion of the chest plate, of the stethoscope chest plate, and I'm going to repeat the auscultation points. So I'm going to listen to the right sternal border, second intercostal space, the aortic valve. Next, I'm going to listen to the left sternal border, second intercostal space, pulmonic valve. Then I'm going to listen to the left sternal border, third intercostal space, Erb's point. Then I'm going to listen to the left sternal border, fourth intercostal space, tricuspid valve. And lastly, I'm going to listen to the left midclavicular line, fifth intercostal space, the mitral valve. Okay. So again, no signs of murmurs, rubs, or gallops, and no S3 or S4 sounds to note. Next, I'm going to go ahead and assess her abdomen. I'm going to begin by visually inspecting the patient's abdomen. Do you mind going ahead and laying flat? Okay, wonderful. So I'm going to go ahead and just lower this. So the skin is intact, dry, and normal for the patient's, and the color is normal for the patient's ethnicity. The skin is intact, and I'm going to begin by auscultating first. So I'm going to switch back over to the diaphragm portion of the chest plate of the stethoscope, and I'm going to start in the right lower quadrant. So I'm going to listen to the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Sounds are normal active on all four quadrants. And then I'm going to begin by light palpations. So light, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So no tenderness to note, no signs of grimacing. Patient seems comfortable with light palpations, and I'm going to go ahead and perform the deep palpations. So the right upper quadrant, left upper quadrant, left lower quadrant. So no signs of masses or distension to note. And lastly, I'm going to check for any liver enlargement or spleen enlargement. So I'm going to take my hand, I'm going to cusp the right upper quadrant along the liver border. Okay. Liver border seems intact and not enlarged. Next, I'm going to come over to the left upper quadrant near the floating ribs and note for any splenomegaly, inflammation of the spleen. So spleen cannot be felt, which is a normal indication. So both the liver and the spleen are within normal limits and not distended or inflamed. Lastly, do you mind sitting up a little bit? I'm going to check for upper extremities. So first I'm going to check for color and temperature. So for patient privacy and for the mock interview, we're just going to go ahead and pretend that this is exposed. So patient's skin is void of bruises, intact, warm, dry, temperature is good. I'm going to check for cap refill. Cap refill is under 2, indicating good perfusion. And then I'm going to go ahead and check for the pulses bilaterally. So pulses are +2, equal bilaterally. And lastly, if I can have you scooch up and then just lay completely flat. Wonderful. So again, for the purposes of the video, we're going to assume that she wasn't wearing any pants. We're going to assess her skin. We're going to assess for any blotching, for any peripheral edema. We're going to check to make sure that the skin is intact, dry, and the temperature is equal bilaterally. So no edema to note, no signs of blotching. Sorry, you mind scooching a little more? So we're going to go ahead and check for cap refill, which is +2, equal bilaterally on both feet. We're going to go ahead and check for the posterior tibialis, for the pulse, and the dorsalis pedis. And the dorsalis pedis. So both the posterior tibialis and the dorsalis pedis pulses are +2, equal bilaterally. And so this is the conclusion of the assessment. The patient tolerated the procedure well. You mind coming forward? Before I left the room, patient was sat in bed comfortably. Call light was within reach. I washed my hands before leaving the room, and I documented everything in the EMR. Thank you.